Okay, and so now we're looking at Fatty's hip, and we found during some of the range of motion, overpressure, and joint play, and testing, and palpation testing, we found some interesting things. We found that when Fatty did active extension, and when I did overpressure, he found a really strong tissue stretch. So, Fatty, could you just extend your leg back as far as you can? Your hip? Good. And it was limited to, he felt a strong tissue stretch in the anterior part of the body, at least that's where he felt it. And when I did overpressure, there's a strong tissue stretch, and it's a bit limited there, and compared to the other side. So there's that, and then when I did resisted testing, could you just sit up for me, Fatty? The edge of the table. We did resisted testing for some of the muscle groups, and we did it on all different ranges. But when I had him seated, actually, and the hips in neutral, or actually in mild flexion, when I asked Fatty to bring his leg up like that, for resisted, I found that that was uncomfortable compared to the other side. It wasn't quite as strong. So it was mildly weak and not as strong and resilient as flexion of the hip on the other side. And finally, when I did joint play was good, it was clear, it was not uncomfortable. When I did palpation, could you lay it on your back, please, for me, Fatty? When I did some palpation, I'm going to just bring his leg up through here. I did palpation of the lumbar spine, I did palpation of the quads and the hamstrings and the glutes. But when I did palpation, oops, right in this region, that's where I found more discomfort. Okay? Discomfort right in there. So we found Fatty limited in extension with a strong tissue stretch. Joint play movements were clear and good. There was no irritation there. Resisted testing showed irritation and mildly uncomfortable in hip flexion, and palpation in the anterior region of the body in this area showed to be uncomfortable. So please go to Blackboard and answer the following questions.